Because what I also find in working with people since I started learning about PRI, I found that number one, they don't emphasize their breathing enough. And number two, I find that a lot of people use their diaphragm as a postural muscle and not
Correct.
necessarily as a respiratory muscle, which also infringes their ability to breathe and move, correct?
Correct.
Okay.
Absolutely.
Mhm.
Yes.
Hey, what's up, everybody? And welcome to Shit Trainer Say, a regular podcast brought to you by the staff of Catalyst Personal Training in University City. And these are conversations that we have with local professionals in the fitness community here in St. Louis that we feel like not only our clients, but you can benefit from as well. So today I have Nancy Hammond, who is the owner of Integrate 360 Physical Therapy in Webster Groves. And Nancy is unique in St. Louis in that she is the only physical therapist in the St. Louis area who is certified in PRI. What is PRI, you might ask? Well, it stands for Postural Restoration Institute. And now that you know what that means, it still doesn't answer your question. So we're going to talk about PRI and why you need to know about it. Because one of the things that I learned in my journey into learning about PRI and movement in the body is that symmetry is a myth. Humans are asymmetrical from the get-go. And that can set us up for a lot, and it does set us up for a lot of problems and pain down the road. So Nancy's here to educate us on what is the cause of some of those symptoms and what is the cure for some of those symptoms. So Nancy, welcome to the show.
Thanks, Jim. Thank you so much for having me. I'm really excited to share some information about PRI. I'm very passionate about it, and I'm just excited to talk about it.
Yeah, absolutely. Because, like I was telling you before, because I'm really excited about it too. But what, like I was telling you before we started recording, is that the biggest roadblock that I have to telling my clients and people in general about PRI is that it's complicated, right?
It's complicated.
So, how to distill that down to an elevator pitch that everybody can understand. Do you have any insight on that?
So there's three things that I usually tell my clients on day one that make postural restoration unique to traditional physical therapy. And the first thing is that, like you already touched on it, is that we appreciate the asymmetry of the human body. So if you cut us open and you look at our organ placement, we're different side to side. You have your heart on the left side, you have 3 lobes of your lung on the right, 2 on the left because your heart's there. Your diaphragm, which should be the muscle you primarily breathe with, is asymmetrical. It's bigger on the right than it is on the left. Your liver sits underneath your right diaphragm, keeping it in a better position to help you breathe. The way your brain's wired is different right to left. So number one, asymmetry of the human body. Second thing, like I just mentioned, your diaphragm is really king or queen of your body because it is the connection between the upper and the lower half. And then the third thing is we have what we call polyarticular chains of muscles. And I say, don't let that term scare you. It's a fancy term for saying that you have chains of muscles on the right and left side of your body. And those chains of muscles should turn on and turn off at different times as you move forward through space. And the reason I like to bring that up on day one is because if I'm instructing a client to do an exercise or an activity, and we're facilitating a specific muscle, there's other muscles in your body on both sides that are turning on and turning off at the same time. And so with PRI, we're constantly assessing these tests to see how our body moves. And sometimes by, firing your right glute max, you'll see head and neck movement change. You'll see arms move differently. And so I like people to appreciate that we're a system and we have these chains of muscles that are changing the way that we move.
Yeah. Yeah, that's good. I like that. So before we get into, because I want to jump into the asymmetry, because that was one of the things that was a light bulb moment for me when I first started learning about postural restoration. Is that, because in movement, as a trainer, we're always looking for that symmetrical movement. Even when we do the functional movement screen, we're looking for asymmetries always are a red flag, right? If you're different, if you move differently right to left, that's a red flag that you have to prioritize. So I'm always thinking about symmetry. So when they said that we are innately asymmetrical that blew me away. So I do want to jump into that. But what are some of the symptoms? And I know it's a wide range, but what are some of the symptoms that your patients present with? What are their complaints when they come to you and it turns out to be a postural restoration issue?
So I will say, like you said, it's a wide spectrum. I see low back pain, neck pain, hip pain on one or both sides, shoulder pain, jaw pain, headaches, foot pain, bunions, um, elbow pain, knee pain. I mean, it's such a, and usually when somebody will come in, maybe it's their low back that's really bothering them, or their right knee. And then we start talking and we start looking at other body parts. And even once I start doing the assessment, oh, I do have some left shoulder pain too. And then, oh, well, I do get headaches once a month, or, and so other things just start coming out. Oh, I have a history of this. And so typically it's not just one body part. It's usually one body part that will get somebody here. But then once we start talking, you see other things kind of unfold.
Gotcha. So it's a wide spectrum because most people, when they come in, they're focused on the symptom, but you're trying to get to the underlying cause. So
Correct.
let's jump in. Let's jump into that asymmetry.
Okay.
Um, so, like you said, we have two lobes on the left because we have to make room for our heart. We have
Correct.
three lobes on our right side. Diaphragm is bigger, stronger, higher dome because of that liver on the right side, and
Yes.
then shallower, smaller, weaker on the left. So we breathe asymmetrically as well,
Correct.
which creates movement, asymmetrical movement in the rib cage, asymmetrical movement in the spine, and asymmetrical movement in the pelvis.
Correct.
Do I have all of that right so far?
You do. Yes. Do you
Okay,
want me
so
to show
that's,
that image of the
yes,
diaphragm?
please, if you can break that down. Because what I also find in working with people since I started learning about PRI and I started working with people, I found that number one, they don't emphasize their breathing enough, and number two, that yeah, that's a great picture. And number two, I find that a lot of people use their diaphragm as a postural muscle and not
Correct.
necessarily as a respiratory muscle, which also infringes their ability to breathe and move, correct?
Correct.
Okay.
Absolutely.
Hmm.
Yes. So you can see this image here, and you can see the right diaphragm is bigger than the left, your heart sitting on top of that left one. And then if you can see the slips that are coming off of the diaphragm attaching to the front of the lumbar spine, you can see on the right, there's two slips. On the left, there's just one. And the slips that are attaching on the right side are also attaching lower. So
Hmm.
keep in mind that we breathe 20 to 24,000 times a day. So with every breath you take, that right diaphragm is pulling on that lumbar spine ever so slightly to the right with each breath that you take, which sets us up for one of the main patterns that we talk about in postural restoration. And that's
Which
not a
is
bad thing. It's the way we're
okay.
designed. We need a side to start from, but we also need to manage that and make sure that we're using both sides of our body.
So, I mean, okay, devil's advocate here. I'm looking at this, and you're absolutely right. There's the diaphragm is asymmetrical, but isn't like somebody can say, well, that's just the way we breathe. Anything that we fix is just going to go right back to that. What would you say to a client that comes in and says that?
And I would say that is true. I mean, because no matter how much you think about it, it's innate in us. It's the way we're designed to be more right lateralized, more right dominant. But it doesn't mean you don't have a left side of your body that you still also have to learn how to use.
Okay.
So I would say if we can teach you to move differently, we can start to retrain your brain and you can be more conscious of it. You can think about the way you're sitting, because if you don't do anything about it, you're going to continue to have pain, right?
Mm-hmm.
And so, or your problem or whatever it is that you've come in for. But if we can start to change the way that you're breathing and get you to think about how to move differently and get other muscles to start working, you can retrain your brain and you can
Okay.
retrain those muscles.
Okay.
Yes, it's going to be harder and you're going to want to go back to your right side, but you have a left side that you need to learn how to use and manage.
Yeah. So walk us through that. Walk us through how you work with your clients to fix this or not fix, but live with this asymmetry so that it can restore movement and eliminate pain?
Right. So in a nutshell, I guess a simple way of saying it. So we do an assessment, again, looking at how your head and neck move, how your arms move, which gives me an indication of what's happening with your rib cage. I watch you breathe. We talk about how you're breathing. We look at your hip and pelvic movement. We look at your foot mechanics. And then we kind of put all that together to see what postural pattern you fit into. From there, then we develop a program based on how your body's moving or that particular client's moving. And that can be getting in different positions, from lying on your back with your feet on a wall, to lying on your side, to sitting on a step, sitting in a chair, standing. And that's really based on kind of where you are as a client. What do you do all day? If you sit all day, I'm probably not going to give you an activity that's sitting. I'm going to give you something to get you on all fours or standing, because we want to get you in a position that's different than you're used to. And so we get in a position that's going to help you reposition your pelvis and your hips, your rib cage. And then all of our activities include breathing, again, because diaphragm is king or queen of your body. So we want to put your diaphragm in a different position, get it, so that you are using the left side more, and just to help reposition everything. And then we're breathing in that position. Once we reposition, then we work on strengthening in that position.
Yeah. And also there's a neuromuscular component too.
Absolutely. And so, and I'm glad you brought that up, because the neuro side of it is huge. I think some of my clients don't often like it when I say, okay, what'd you feel? Because some people they don't have any idea of what they're feeling, but it's really important that you feel and sense what your body's doing in order for your brain to learn that task.
Yeah, I like that.
And so it's one thing to just go through the motions. You can go to the gym and you can do weights, and people can come in here and move and go to PT and do those things. But if you're not aware and conscious and in tune with what's happening with your body, it's going to be really hard for your brain to learn it.
Yeah. And that's the hardest part is re-educating your brain to move in a new movement pattern, because all of that is like software that runs in the background, and, it's designed that way. So we don't have to think about moving, so to speak, how to get out of a car, how to walk across a parking lot. But when you're in pain and you're not moving well, you got to spend tremendous amount of brain power figuring that out. If your current pattern isn't correct, then you're going to wind up spending time on it anyway. So you might as well do it proactively. So now that we know that the diaphragm, the rib cage, and everything else is not symmetrical, let's talk about the pelvis, because a lot of people think the pelvis is symmetrical, or I used to think it was just one big bowl, right, that moved as one piece. But it can articulate right to left in a three-dimensional way, correct?
Right. Yes. So let's stop screen sharing and I can show the pelvis model. Okay. Let's see. You can see this. Can you see that?
Yep.
Okay.
I can see it.
So this is looking at the pelvis from the front. Okay. And like you said, we want your pelvis to alternate. So as one side goes forward, the other side goes back. So this should happen when you walk, when you run, whatever you're doing to move forward through space. Okay. But often what happens is our pelvis gets stuck, rotated forward and out on the left side. And that's because we tend to be more right dominant, like we talked about, more lateralized to the right. So if we're standing on our right leg, that right pelvis is going to come back. Often we turn our left leg out to the side. If you watch most people stand in the grocery store, wherever, this is how they stand.
Yep.
Okay. So again, the diaphragm is here. This is L5, L4. So it's actually attaching higher, but for all intents and purposes, with every breath that you take, that diaphragm is ever so slightly rotating that lumbar spine to the right, which is allowing that right pelvis to come back and the left one to go forward.
And people get stuck in that pattern, right?
They do, right. So one of our main goals is to help bring that left pelvis back to a neutral position. And then we teach you how to alternate forward and back.
And that can present itself as like back pain, hip pain, knee pain, ankle pain, anything along that chain, that movement chain. Okay.
Yeah. And then because we haven't talked about it yet, but because the rib cage is also chain, it's also not symmetrical. We can have shoulder pain. We can have therefore elbow pain, wrist pain, neck pain.
Yeah, tennis elbow is a common one that I find.
It is.
Yeah. Okay. And then, so now that we've talked about like the innate asymmetries and how they can be exacerbated and create symptoms, mainly pain and discomfort or lack, and then down the road, decrease range of motion or decrease ability to move. You want to go back to the screen share to show some of the examples, some of the extreme examples that you see people presenting with that have PRI, underlying postural restoration issues?
Sure. Okay, so we will see one or both legs turned out in any position, when you sit, when you stand, when you lie down. So again, it usually starts with that left one turned out first. Sometimes it's the right, or sometimes both, because you can then get into compensatory pattern. The left one starts forward first, but sometimes then the right pelvis rotates forward. And so then both sides of your pelvis are rotated forward, both hips will rotate out, and therefore both legs will be turned out.
Okay.
So we'll see overdevelopment of compensatory muscles. So you can see the lats here in that first top picture on the left. Gastroc muscles, people like to overuse their gastrocs, quads, and then those paravertebral muscles you can see.
Yeah, the low back. Yep.
Very common.
Mm-hmm.
So like I mentioned, most people like to stand on their right side with their upper body then rotated to the left. So if I took that picture on the left at one of my kids' soccer games, just two dads standing there talking, they're both standing in the same pattern.
Yeah. Yep. I see that a lot.
Mm-hmm.
I notice it more when people stand in the left leg stance.
Right. And even when you're standing on your left leg, we need to make sure, always when I teach my patients to stand on their left leg, you have to truly get on your left side, because you can stand with more weight on your left, but your upper body, your thorax is still shifted to the right. That's not true left stance. So you need to be careful. I don't want people to take from this, I'm just going to stand on my left leg. Well, there's a proper way to stand on your left leg. And some people don't know how to truly properly stand on their right leg. So we have to make sure that you're truly getting into good stance so that you can use that when you move forward through space. Gotcha. A lot of people don't like to swing either arm when they walk, or especially their right arm.
Okay.
So
interesting.
It's interesting that a lot of clients, I watch my clients walk, and I'll say, you don't really swing your arms when you walk. Oh, I should swing my arms? Absolutely, because when you swing your arms, that's when your rib cage is rotating. In order for your pelvis to rotate, your rib cage has to rotate.
Yeah. Okay.
And then we see a lot of these elevated ribs on the front left. And again, that's because that left diaphragm is smaller. You have your liver sitting underneath that right diaphragm, keeping it in a better position. So that left diaphragm is smaller, it's weaker. That left abdominal wall gets weaker, and it's not able to keep those left ribs down in the correct position. So that's very common that I see with my clients.
Yeah, I still have that. I still have that rib flare.
Right. No matter how hard you work, it's innate in us.
Yes.
So, and it's important that you realize as you try to bring those ribs down, like you mentioned earlier, we're triplanar. So it's not just trying to get those ribs to move in one direction, they have to move in 3 planes. And sometimes that rib flare can stick around if you don't appreciate the triplanar motion of the rib cage.
Okay.
We see a lot of lower depressed shoulders on the right, and then flatter right chest walls. We see a lot of hyperinflated left chest walls because your right diaphragm is stronger and it's putting more air into your left chest.
Okay.
And also, when you look, I look at all my clients, where their shoulders sit, most of them have that right lower shoulder, just because again, we're more lateralized to the right. We like to stand on our right side. That brings that right shoulder down.
I know I have that too. When I was getting measured for a suit, the tailor noticed that.
And you might notice a difference in your arm sleeves or your pant legs.
Yeah.
And then sometimes we see asymmetry of the head and face. And that's sometimes, people will look in the mirror and they'll notice they're not symmetrical side to side. And then we do see curvature of the spine, scoliosis. So I do treat clients with scoliosis as well, because the spine's going to follow the rib cage. And so if we have some curvature, which curvature of the spine is normal, but getting stuck there is not. So your
Gotcha.
spine's going to curve when you move forward through space. We just don't want that curvature to get stuck.
Okay. So now that we understand the innate asymmetries that we're dealing with and how the diaphragm plays a role in that and some of the issues that people can present with, how do you fix it?
So I do have, I do have some pictures of some of the activities we use. So I do have some of the tests that we do. I don't know if that's helpful for you, or you just want to get into
Sure.
the treatment.
No, let's talk about the test. So, I mean, is this something that, well, yeah, just so people can check it out for themselves.
So some of these would be hard to do on yourself.
Mm-hmm.
But because that left pelvis is rotated forward, it changes the position of the way the head of the femur can sit in the socket. And so you'll have an inability to adduct your left femur. So you can see in the top picture that leg won't drop to the table and the right one
Yes.
does.
Yeah.
So that's a common test that we do to check position of the hip and pelvis. We have limited trunk rotation to the right, again, because we're stuck in that left rotated trunk position. So it's harder for us to rotate to the right. It's harder for you to get on your left leg and rotate your trunk to the right. We'll see limited rotation of that right shoulder, sometimes both. But again, the underlying pattern is for the right shoulder internal rotation to be limited. An inability to take your left arm off of the table, again, because you're already stuck in that left trunk rotated position and your arm is just an extension of your trunk. So you're just stuck there.
Mm-hmm.
That's a big test that tells me, do you have the ability to shift over to the left side of your body?
Okay.
We'll see asymmetrical hip rotation, again, because of the position of the pelvis. And we can see either too much or not enough straight leg raise. I have lots of clients who come and say, oh, I've always been tight. I've always had tight hamstrings. And I'll say, I might be the first PT to tell you, but we don't want to stretch your hamstrings unless your pelvis is in the correct position. Hamstring stretching is a very common PT thing to do. Mm-hmm. And once I learned PRI, I learned that may not always be the best thing to do unless the hips and pelvis are in the correct position.
Yeah. Because the position of the hips and pelvis can change to the length of the hamstring.
Absolutely. And people are amazed sometimes just by doing some repositioning, which actually includes facilitating your hamstrings to move your pelvis back to the correct position. You will then gain normal hamstring length. And we never did anything to stretch your hamstrings. Mm-hmm. An inability to touch your toes. Inability to fully squat. So you can see here, she has her knees turned out, her feet turned out. Okay, so those are the pictures I have of the tests and things that our bodies sometimes have a hard time doing when we're in this pattern that we talked about earlier.
Okay.
And then let's go to.
So let's get out our toolkit, our balloons, and fix this problem.
Here we go. All right. So here in this first picture, like I just mentioned, we're going to use in this picture, we're using that left hamstring to reposition that left pelvis. So there's a specific way to get into this position. So she's raising just her tailbone, keeping her back flat so she doesn't use her back, facilitating her hamstring. And she's taking her right leg out of the picture so it can't help out, and using that left hamstring to reposition that pelvis. And then in that position, she would be breathing 4 to 5 deep breaths in through her nose and out through her mouth.
Yeah. So
one way that we could reposition pelvis, rib cage, head and neck.
So after they come to you and you do your assessment, then you figure out which muscles they're underusing and which ones they're overusing.
Correct.
And then you strengthen the ones that they're not using, and
Correct.
You not remove, but take out of the equation the ones that they use as a compensator.
Correct. I like to use the words facilitate and inhibit. Okay. So we facilitate muscles that are not doing their job, and we inhibit muscles that are doing too much.
Got it. Okay.
So that's one for repositioning. Again, this can be a repositioning, this can be a retraining activity. So I don't know how much in depth you want me to go of what's happening here, or if you just want to see kind of images of what we do.
Yeah, well, I kind of get an idea, and I don't want to get too much into the weeds because I don't want to lose the listeners. But
Sure.
the one thing that I have always found fascinating, right there, is the use of balloons, the use of incorporating, again, putting in that diaphragm in a certain position, and then using that diaphragm because it is a big, powerful muscle.
Very
And
powerful.
using that diaphragm to help you position. So when I have people come in and part of their warm up is blowing up a balloon, they're like, what is with this guy? These freaking balloons.
Right.
So can you explain that a little bit
Sure.
more?
So this is what I tell my clients, that we use balloons because when you blow a balloon, it forces you to breathe in through your nose. It forces you to blow all the way out through your mouth. And when you blow all the way out through your mouth, your ribs are moving down towards your feet, in towards your midline, and back towards your spine. They should be. Those are the three
Mhm.
planes of motion that we want. And so we want to make sure that you're getting those ribs all the way down in and back, because then your diaphragm can fully relax and come up into that domed position. So when you go to take your next breath in, it can recontract from a relaxed state.
Okay.
So a balloon is a very powerful tool. It also gives some resistance to your diaphragm and to your abdominals, but it's
Mhm.
mostly just because it's forcing you to fully exhale.
Okay.
We also, when you're blowing up the balloon, we pause after we exhale because that allows the diaphragm to fully relax. And we're also doing certain things with your tongue. And again, I don't want to lose people, but there's a lot of things that are happening as we blow up a balloon. There's kind of a method to the madness of doing it.
Mhm.
So we want to make sure that, I always make sure I teach my clients how to blow up the balloon properly. I know that sounds
Mhm.
funny, but for our purposes, there is a way that we like to have you do it.
Absolutely. It's a skill. I mean, it took me a long time to blow it
So,
up, to learn
but
how
it
to
is a
blow it up.
very, and people will joke, they'll do it once in a specific position. I'll recheck them. And it's like, that's like a party trick because your body moves differently. Again, you've inhibited muscles,
Mhm.
you've turned on other muscles. And so it can just change the way your body moves. And once you experience it, it's pretty life-changing.
Yeah, I agree. And it is like I call it the body voodoo, right?
Yeah, right.
They're
It
like,
is.
was this real? Did this
Right.
just happen? Yeah, absolutely.
Yeah. Somebody asked me, are you a witch? I'm like, no, I'm not a witch. It's not voodoo.
Yeah,
There's a
right.
science behind it.
Right, exactly. So, what else should people know about PRI or you or Integrate 360?
Well, so I would just say, if you're having any type of pain, you're noticing an asymmetry about yourself, you're not able to do the things you want to do, you can't garden, you can't go for walks, you can't run, you can't ride a bike, there's things that you can't do. Those are the type of people that I see. Just something that you would go to a chiropractor for, traditional physical therapy for. And this is just a kind of a different, unique approach to looking at things. I would also say that my goal is to teach you how to manage your own pain and your own body movements. I don't fix you, I teach you how to fix yourself. And so if you've tried traditional physical therapy or you've worked with a chiropractor and you have to go multiple times a week or weekly, this is a really good alternative to actually learn how to sit and stand and drive and sleep and manage your asymmetry better.
Yeah. And also, I think a lot of people that present with pain usually wind up going to the orthopedic guy too. Like, I know for me, I thought I was headed for a hip replacement, to
Mhm.
be honest with you, and started until I started doing some of this work, and then my hip pain went away.
That's awesome.
And when I went to the ortho, he's like, "Yeah, you're probably going to need a hip replacement," and I was like, "Screw you," you know. I'm going to try to figure something out on my own.
Right.
And so, fortunately, this did help me. And so I became a big believer in it.
And I think that
So,
brings up a really good point because typically when you go to an orthopedist, I mean, they definitely have their place. They're usually very good at surgery. But if
mhm,
you go for your hip, they're going to look just at your hip. Or if you go for your
right.
knee, they're going to look just at your knee. And very oftentimes, the knee pain is coming from what's not happening at the hip and the pelvis.
Yeah.
And so we don't want to look at your body as compartmentalized. We want to look at it as a system. And that's one thing that I really appreciate about PRI is that we're a system, you know, from head to toe, everything has to work together. And how you're breathing, you know, from neurology to respiration to vascular. I mean, it's a system. It's not just orthopedic.
Yeah, I agree with that because, I see a lot of runners and I think it goes across all kind of athletes, but runners especially is like they wind up with injuries, but they continue to run through the injuries. And then the doctor will tell them, well, you can't run anymore. Well, I tell them you can't run anymore like that,
Right. That's great.
but let's teach you how you can run
Right.
if it's possible. And so change, like you said, looking at the body as one mechanism, or a mechanism that works together, and how one movement, a movement at one joint plays into movement at other joints,
Right.
and training that and assessing that, re-educating it and training it to stick and stay could enable somebody to run a little bit longer.
Absolutely. And since you brought up runners, I will say shoes, no matter if you're a runner or not a runner, shoes make an immense difference in how your body functions. So we look at specific criteria in your shoes. All the shoes that I recommend to my clients, whether they're runners or not, they're all running type of shoes, but they meet a specific criteria and can make a huge difference in how your body functions. So your head and neck and your foot and ankle are like best friends. And so if your foot and ankle are moving properly, your head and neck are going to move a lot better.
Hmm.
So,
I
so
learned, I
that's
learned.
that's one thing that I talk with all my clients about is footwear, and we really hit hard on that.
Yeah. Well, you know what, Nancy? That's a good point. I would love to have you back on, do a second episode, and we
Sure,
just talk about that. We talk about footwear for runners and how that affects the overall movement of the person's running.
sure. I'd love to do that.
Yeah, yeah, let's get that on the books for sure.
Okay.
But for now, if people want to find out more about you, about Integrate 360, about postural restoration, if it's for them or not, where do they go to get more information, reach out to you, talk to you?
So integrate360pt.com is my website. You can, if you look it up, you can find my phone number. You can email me. I'd be happy to talk to anybody. If you have any questions, like to set up an appointment. And then the posturalrestoration.com is the PRI website. They have a lot of resources. There's tons of information on their website too, to learn more about the science. If courses, case studies. So looking for a provider in your area. If you're not in the St. Louis area, you can find a provider wherever you are in the country or internationally now.
Yeah. Awesome. And then those links will be in the show notes. Just go to catalyststl.com/podcast. Look for this episode, and all the links to contact Nancy will be right there. And I will tell you that Nancy has been to our club and given our trainers in service on postural restoration. We've gone to, and several of the trainers have gone to postural restoration seminars to learn more about it and incorporate it into our training over at Catalyst Strength. And we work very closely with the PTs that send us clients, or we send clients to, when we know they have a specialty like Nancy with a PRI. So feel free to reach out and check out Catalyst as well. Well,
Thank you,
Nancy,
Jim.
thank you. It's good to see you. Good to catch up with you again.
Absolutely. I
And
really appreciate you asking me to do this. It was fun. Good to
yeah,
share information.
well, I'm all about that education. And like I said, I know PRI can be a big thing to tackle because it can be so complicated, because the body does move three-dimensionally,
Right.
and especially when you're talking asymmetrically, it's a lot to try to kind of visualize and put together in your head. I know it took me a while. So if any way that we can distill that down so that the average person can understand it and recognize it, and maybe even act on it to improve their life, their activities, their movement, get out of pain, I'm all for. So
Right.
thanks again. And I definitely want to have you back on, and we can talk about footwear and running.
Okay. That'd be great. I look forward to it.
Okay. All right. Great.
Okay.
Thanks, Nancy. I
Okay.
appreciate it. Have a good rest of your day.
Thanks. You too. I'll talk to you soon.